Hello. Uh, it's been a while. It's been a while because this has just been a whole lot to go through and recover from. Let me just say I am 3 weeks post-op. I had the Ross procedure for my aortic valve replacement surgery. I found out that I had a heart defect I had no idea that I knew about, and this was picked up. I knew I was sick. I've been sick for years, but I kind of got dismissed by doctors and it was put down to other things. I was even put on antidepressants. Lo and behold, it was my heart all along. So I found out that I needed my valve replaced only because I was going in for surgery for another procedure. And I was going through all of the pre-admin stuff, and I got called in to speak to a cardiologist immediately, which I did. And she broke the news to me that we cannot do I've got endometriosis basically, and was having surgery on that. We can't do that because you need urgent heart surgery. It was a lot to process, to the point that I look at my reaction now. I was just devastated that I couldn't get my surgery on my endometriosis. I've been waiting so long for that. I'd been on a waiting list for 6 months. I have been bleeding endlessly, iron infusions, blood transfusions. So to be told they can't do this surgery to stop my bleeding, I was so upset. And then I left and I went, okay. It took me 24 hours to process the idea that I suddenly had this congenital heart defect that was basically as bad as it can get until you either have an aneurysm or need surgery. So I guess it was lucky that I happened to need that other surgery, because if I did not, I still would be unaware of it. I still would be suffering the chronic fatigue that I have been for the last number of years. But it did take me a little while to process it. So by the next time I went in, I was able to go, okay, we're doing heart surgery first. I was really worried. I've been bleeding for so long that my hemoglobin was so low that I was worried that it was risky to do my heart surgery while I was bleeding out and with no hemoglobin or iron in my body. And that wasn't ideal. So I wanted them to just knock me out. I'll accept the risk, stop the bleeding of my endo stuff, so that I can actually have blood in my body for this open heart surgery. Anyway, they could not do that. They could not take that risk. I was told I'd die during the surgery. I don't know that I would have, but okay. And that they had to do this heart stuff first. So I had to really just work that out in my head and accept that. So, check me out. It goes down further. I will not do that to you. This is what it looks like. This is 3 weeks post-op. I'm in Australia. It's summer. It's super bloody hot here. So I've actually been, although I'm at the stage where it's not, you don't want to cover it. You don't need to, and it's good not to. Sorry. Stay. You're not staying, are you? No, you're not staying. What was I saying? Oh yeah, I feel bad. Like, I feel, you can see it. You can see it out the top of my tops, and it's quite moderately gruesome. So what I do is I put just like a little band-aid that kind of just goes over the top part that sticks out on my top when I'm going out, just so people don't, I don't know, maybe I'm a bit self-conscious. Not about having a scar, but about having a kind of an active looking wound. Oh my God. Now what just happened then brings me to the whole point of making this video. Oh my God. I was not prepared for how hard this was going to be. About 1 million surgeries. I've got a high pain tolerance. It's the first 2 weeks will have you going, what on earth have I just done to myself? What on earth have they done to me? You know, you're warned pretty much wherever you are that you're going to feel like you've been hit by a truck. And I feel like I've been hit by a truck. And I felt like that for 2 weeks. Now I feel like I've been hit by a little truck. Maybe a car. Man. Don't get me wrong. I'm so glad that this is done. I'm so glad I made this decision to get this procedure. I don't think it matters what procedure you're getting. If they are cracking your chest open, you are going to be doing it rough. Bones and cartilage take a long time to heal, and you're trying to heal a moving thing. So it's not like an arm where you can stick it in a cast. You've got to breathe, you've got to go to the toilet, you've got to speak, you've got to sit. You have no idea the muscles that you are using in your diaphragm and your chest until you have a procedure like this. Like, it's everything you do moves this. Hang on a minute. Oh, now, I don't know if you heard that. So this is what's happening, right? Oh my God, it's so friggin' gross. I might make it happen next to the thing so you can hear. But let me explain it first. You are sawn with an electric saw down the midline of your sternum. You have retractors that crack your ribs open to expose your heart so that surgery can be performed on your heart. And then it's rewired shut with titanium wire. And oh my goodness, you've got no idea. It's going to be harder than you think. And you're going to have moments of going, what have I done? But I want you to know at 3 weeks post-op, I'm literally to the point where I have to stop myself from doing things because I feel well enough to do everything. I mowed the lawn yesterday. Don't tell anybody, especially my mum and my surgeon. They'd kill me. I know my surgeon would kill me. My surgeon told me not to get any more tattoos, which I don't know if that's something that I can abide by, but we'll see. I'm not going to get any tattoos anytime soon. But I was going to get some kind of a tattoo over this scar. Anyway, that is just besides the point. Every time I move, shift, breathe, talk, my chest clicks. You can hear it shifting. You can hear it. You can hear the bones moving. People outside of me can hear it. So it's not just me feeling it. People hear it. And I don't know. I'm just the kind of person, I feel good, so I do stuff. And I've had to be really reminded a few times, you know, I've made such progress and then I've done stupid things and it's put me in bed for a day. So don't do what I do. You need to dedicate yourself to healing this because you don't want it to happen again. You do not want them to have to go in again. It's just the thought of them going in again. I mean, if it had to happen, it happened, but oh my God, my intensive care experience was not good and I do not want to go in there again. That was to do with people, by the way, not pain levels. Actually, it was a mixture of both. Let me tell you, I'm a vet nurse, right? Pain is always, always better if it's treated preemptively, i.e. you're cutting open somebody's fucking chest. You give them all the pain relief so that when they wake up, they're not in agony. And I've had this happen twice now for orthopedic surgeries where bones are concerned, where it's like, oh, we just wanted to wake you up and see how you're feeling. I've just had my fucking chest sawn open with a saw. Look how handsome my other boy is. Oh my God, he's a tiny lion. Look at him. I've got 3 cats, by the way. They've been my buddies. Post-operatively, you can't do anything, but you can cuddle your kitties. And this is my baby kitty. He also plays video games on this iPad. So he comes up to it and he starts swiping it because he wants to get into his mousy game. 2025. My cat runs up to any screen he sees and starts swiping it because he thinks it's a touch screen. He does it to the TV and he does it to the microwave. Because you're so smart. You know how to work stuff. Hey? Yeah. So I was woken up in screaming agony. I'm pissed off because my heart rate went up to 200 beats per minute. You are not allowed to have a heart rate that does that or blood pressure that is high after you have this surgery. I'm so worried. I'm still worried that waking up that way ruined my heart. Like, I'm yet to have my follow-up appointment. And part of me is really scared that that time in intensive care caused me damage because I had to basically, I was screaming in pain and I was being ignored. I was being told to go to sleep. You go to fucking sleep after you've just had your chest sawn open and you're not on pain. You go to sleep and you just try doing that. You know, I got sent a survey about, we want to know about your time in intensive care. And I'm not going to fill it out because I might need to go back to intensive care in that hospital. And I do not want I don't want my complaint to affect my care. So I can't be honest and I can't say what I want to say, even though I should and I would if I knew I didn't have to go back there. But I'm a lifelong patient of this surgeon now and I just can't afford to. I already had to yell at, and I don't yell at anyone, I had to yell at the intensive care nurses because ultimately what happened, and my nurse friend described this, that intensive care nurses are used to unconscious people, right? So me being awake and in pain was hard for them, and yeah, it's just awful. Just being told to lay still and go back to sleep. Anyway, the outcome of that 200 beats per minute, yelling at all the nurses, got me a fentanyl button. So they mixed fentanyl with something else, and I was given that. You can self-medicate yourself. Oh my God, fentanyl works for pain so well. Like that, once that happened, that everything changed. But I'm pissed off that it needs to get to that point to be given proper pain relief. I understand that people abuse pain relief. I understand that you don't want to get people addicted to things and all the things. But when you're sawing someone's chest open with a fucking electric saw and operating on their heart and wiring it back together, that's a legitimate reason to have absolutely thorough pain control before you wake up and during your fucking recovery. I'm so mad about it. Makes me really mad. Same thing happened to me when I was younger, and I was having a really invasive surgery on my knee where they had to drive metal titanium spikes into my femur, into my bones. And then they thought they'd just wake me up and see how I fucking felt. How do you think I'm gonna feel after that? Just God, it just makes me so fucking angry, and I really would love to give them my honest opinion, but I don't want it to affect my care, and that's the reality of it. I'm a patient of this hospital now. I may need to have revision surgeries. I just don't want to jeopardize my care if that happens again. So where I'm at now, I'm mostly good. There is still pain, but it's not nearly as bad as it was. The first 2 weeks were a nightmare. And sneezing, oh my God, you have no idea how much sneezing. You can literally feel it opening up your sternum. The pain is intense. I don't know if my sternum is knitting back together. It moves every time I move. It cracks, it creaks, you can hear it. My GP seemed to be not too worried about that. I'm a little bit worried about that. So we'll see what the surgeon has to say about that. What else? You get through it. You get through it. You need to know that it is going to be really hard, harder than you thought, possibly harder than anything you've ever done. And it takes... I recorded a video that I didn't share just maybe a week ago. They warn you about depression following heart surgery, and I just disregarded that. And oh boy, did it hit me. And it hits you because suddenly you are home alone. Well, I was home alone. You might be home with care. I don't think it'd matter. Either way, you feel so weak, and so out of control, and so unable to do normal things that it gets you down, gets you really down. It makes you start wondering, what have I done? And am I ever going to get better? Sorry, my legs are going numb because I'm sitting on them. Oh, that's the other thing. I put on 12 kilos of fluid after my surgery. I had no ankles. I cannot tell you how swollen my feet and toes and legs were. They didn't even look like feet like it was insane, the amount of fluid. And apparently it's very normal. So I went in weighing 75 kilos and I walked out 12 kilos heavier than that. And gradually the diuretics that they give you has worked, and my body has worked, and my feet and my ankles and everything is back to normal. So whilst I have a numb leg right now, it's because I was sitting on it, not because of any kind of a circulation issue. So yeah, you can have really down moments, and scary moments. So moments where, like yesterday, I said to my daughter, and I shouldn't have put this on her, but it just happened. I started to have a panic attack. And I'm not a panic attack person, but I started to think, what if my heart hasn't worked? What if this hasn't worked? What if that time in intensive care ruined it? I can't undergo this again. And I shouldn't have put this on her because it made her have to do the whole, oh, but didn't, you know. Anyway, I'm pretty open and honest when it comes to everything with everyone, including my daughter. So I then sort of, it's okay. I said, it's okay. I'm literally just having a panic attack. Let me just sit down and I'll be okay. And I was. But you do have moments like that. You have moments where you feel like an invalid. You feel a loss of control over your life. The whole world is out there. And in my case, during Christmas and New Year's and all these fucking things, and you were stuck at home, unable to do anything. And it's scary and it's lonely and it's full on. And look, recovery times are different for everybody. I found it interesting that I was watching people who'd had my surgery before me in the ward, and they were all gingerly walking on these full-on walkers that stand you upright and you carry your weight. And I just got out of bed and walked like I walked in there. There was no difference. I was just instantly sturdy on my feet. You know, I think I was perhaps younger than pretty much everybody there. And I think that would make a big difference. You know, I had the physio come in and he's like, okay, we're going to start physio today. I want you to start by going for a walk and walking up these stairs. So I went for the walk and I walked up the stairs and he goes, do you know what? I don't think we need to see each other again. So for me, I was able to just get up and walk like normal, and in fact, probably better, because my heart was so poorly functioning that, and now it was working. So even though I was recovering from all this pain and trauma, my heart was working better. And I think that had something to do with it. I think my age had something to do with it. I think my keenness to get the hell out of the hospital had something to do with it. But if you need the walker and you need the support, it's there, and that tends to be what people have. Older people will then go to rehab. I just kind of walked out and went home. I can hear in talking to you now, my voice isn't quite right still. So I still do have some fluid on my chest, and when I do too much, which I did yesterday, that gets worse. And it leads to me having this croaky voice that isn't, I have a deep husky voice anyway, but this is different, and I can hear it, and you can probably hear it, and you hear the same thing in other people who've just had the operation too. It takes a while for your body to get over the fact that they've stopped your heart, they've rerouted your blood, they've mixed it with a whole lot of anticoagulants and fluid, and then they stick it all back in you. Your body has to deal with it, as well as deal with all of the healing from the surgery. So you're in shock for 2 weeks. Your body is in shock. Once you come out of that, as I have now, I guess you're at risk. Well, I'm at risk of doing too much because I feel good and then I do shit and then I feel bad. I think part of it is because I am a single mum. So I don't have someone to be doing everything for me like a lot of people have they have a partner or something like that. So that's something. Look, I'm fiercely independent anyway, so it's just who I am. I think that please feel free to ask me anything about anything to do with this. It's a scary thing to do, but I can't tell you what to do. I can tell you that I did a lot of research, and having the Ross procedure is just a no-brainer. It's riskier, it's more complicated, but your lifespan post-surgery is so much better, statistically, like so much better. You know, if this is done well and it's worked, there's only a 2 to 3% chance that I'll need surgical intervention again. It gives me a normal lifespan. These other valves, the other things, they are great. They are life-saving. I would have had that if I wasn't a candidate for this. And I would have had that. It took my cardiologist. So I was going in for a cow valve, right? And my cardiologist came in to see me on the day of my angiogram, and she said, I have been thinking about you all week. My best friend is one of the only 2 surgeons in Melbourne that does this kind of surgery that I would like you to get because of your age, because you're a mum, and because we want you to have the longest lifespan that you can with this condition. So my best friend just happens to be one of those surgeons, and he's happy to see you tomorrow. And I am so glad for that, because the other valves will be great. They will save lives, but you will need things in the future. And each time you need things done, it becomes harder to do because you've had it done before. You're working with tissue that's already been operated on. It does affect your lifespan overall, usually, if you have the other procedures. What is interesting now, because I feel a little bit bad that people who've had the other procedures just a little bit before now, when suddenly this has come in and shown to be so much more effective, I had wondered if patients who'd had like the mechanical valve or a cow valve could then have the Ross procedure. And they can. It turns out they can. Well, if you're a candidate for it, like the rest of us. Which is great for them because, you know, there's a heap of young people just that have had this in the years just recently gone, and they've had the cow valve or they've had the mechanical valve, and I felt bad for them. I like to the point that I can't even say anything on Facebook because my best friend has had a PIC valve. And the outcome for that long term is just not as good. But it turns out you can, in fact, now go in after one of these procedures and have the Ross procedure, which is excellent option for those who feel that that's what they would like. I think that's it, guys. I'm doing okay. I have really low hemoglobin. I'm going to the doctor about that this morning to see if I need an iron infusion. But other than that, I'm doing well. I'm clicking. It's gross. I don't like it. I'm doing too much. I shouldn't. All of that. So, yeah, okay, that's been a half hour I've been talking for. So I'm going to go now. But feel free to ask me any questions you like about the procedure. It's scary, and there's not a lot out there. There's not a lot of people talking about it out there. You know, you Google it, you put it into YouTube, You want to see real people talking about having the experience. You don't want these highly polished fucking doctors giving you the highly polished bullshit. They're okay, they know about it, they're doing it, but they're not experiencing it. And you want to hear from people that have experienced it, what it's like before you go under, what it's like to wake up afterwards, and what it's like for the next weeks, months. So that's me so far, 3 weeks post-op. Yeah, I'm going to go get ready for the doctors. Bye.